Okay, hello and welcome to Level 3 Health and Social Care, Unit 6, Understanding Stroke Care. And this week we're going to look at Part 3, the effects of stroke. So how does stroke affect someone? Our objectives are criteria 1.4 in your assignment sheet. Discuss the effects of a CVA or stroke on individuals. Okay, here's an overview of the effects of stroke. A stroke can cause permanent loss of function in all sorts of different areas. The long-term effects really depend on which part of the brain was damaged and by how much. If treatment and rehab happens very, very early, very, very quickly after the stroke has happened, people can recover quite well. So the quicker the intervention, the better the chance of recovery. And many people do regain quite a lot of functions, especially younger people tend to regain quite a lot of function. And if they work very hard at their rehab, they can, lots of people can almost regain all of their function. So it really, really depends on how important that medical intervention is, but not just how quick it is, but the quality of that intervention. How well is it done? And what are the right areas to focus on? And is the right level of rehab involved? Is there work happening on muscles, on the cognitive issues, all sorts of things, really. So generally, though, after a stroke, at least 1/3 of the people who have a stroke, unfortunately, can be left with some sort of disability that can affect their daily living activities. Of the people with a disability after stroke, most people manage to be cared for at home, maybe with a little extra support or some personal care, but some will not recover that well and they may need residential care or they may need a much higher level of care and support. Probably these are the sorts of people that if you're on a care home placement, you might be working with these sort of people who have not recovered that well from this. Most common types of disability after stroke are impaired speech, although that can improve with intensive speech and language, but not for everyone. More often than not, restricted physical abilities, such as weakness or paralysis of limbs on one side of the body, or maybe something just as simple as gripping or holding things properly. And sometimes the ability to communicate gets slowed down, maybe to find and remember the right words, even though they can actually speak. So when someone is having a stroke, some of the most immediate warning signs are things we need to be aware of so that we can act fast on it. And fast is the word that we use to remind ourselves of how to spot a stroke, really. And this, although this is a UK campaign, you'll find that the campaign's very, very similar, often using the fast idea, will be all over the world. So the 4 things you look for is the face drooping on one side? Is it droopy? Or is it, even if it's just numb on one side, the numbness that stays there, not that maybe sometimes we sleep on our face and wake up with a little bit of a numb face, but it goes away in a few minutes. Something that sort of people are sort of stuck with for a while and doesn't seem to improve. Ask the person to smile. Is their smile uneven? Are they sort of tipping up at one side but not tipping up at the other? Have a look in the picture there, you can see it. So if you see any of these things, you do need to act on it. Is there an arm weakness on one side or the other? Is it numb or is it weak? Have they lost the strength in one arm? You could always ask them to raise both their arms in the air. If they do that, if you've had a stroke, one of them, they either might not be able to raise it or one of them might just sort of drift down without them sort of being aware of it. A very obvious symptom is their speech difficulty. If they didn't have it yesterday, but they have it now, is their speech slurred? Unfortunately, some people, have a stroke in the street, and people think when they fall over, because of their slurred speech, they might think they're drunk, so they might sort of ignore them. But if you do see somebody like that, just be aware of it, because they might have had a stroke as well. And the T at the end of fast means it's time to call 999 in this country, or whatever the emergency number, 911, or whatever the emergency number is in your country, or wherever you are in the world, really. So remember, FAST, fast, face, arm, speech, time. Okay, very important things. And this is something you can do just as an ordinary person in the street, or looking after family. You could act on it, and you could share this with other people as well. Other immediate warning symptoms to look for maybe, as I said, numbness, not just on the face, but also maybe in the hands and along the arm on one side of the body. So if they may not have that much weakness, but if their leg and arm all the way down one side is sort of numb, and again, not something you've been sleeping on, but something that after about half an hour hasn't really changed, you can act on that. Confusion, if they suddenly, if you're going to see somebody and they don't know who you are, or they can't remember what they've just said, or if they're having trouble speaking or understanding what you're saying to them. They may all of a sudden have problems with their vision, maybe in one eye or both eye, but again, something they didn't have yesterday, really. If they have trouble walking, like they're constantly dizzy, or their balance has gone, and they keep sort of wobbling about and trying to fall over, or they can't coordinate their arms and legs, this could be a warning factor. And a very, very severe headache with no obvious cause is always worth a check. It could be other things as well. Okay. So we're thinking about someone, though. Those were the pre-stroke warnings, but now let's think about someone who's had a stroke. They may well have gone to hospital. And what sort of physical changes could happen after a stroke? Now, all the changes I'm going to tell you, these are all the possible changes, but some people may just have one or two of them. Some people might have quite a few of them. Some people might just have one of them. So there is no, set answer, but you need to be aware of some of the possible changes. Difficulty with gripping or holding things. Fatigue or tiredness, getting much tireder than maybe they used to. This can also be caused by their medication. They often put people on medication fairly quickly, but also they could have mood changes as well, like depression or anxiety, or they might have trouble sleeping, or they might sleep quite a lot as well. Incontinence, that also can be caused by medication, but it can be caused by some of the muscle weaknesses or part of the paralysis as well. And it also can be caused by disturbances in the brain, where people's memory and thinking processes aren't working rightly. So they don't recognize that feeling is wanting to go to the toilet anymore, unfortunately. Pain can be caused by the actual damage to your tissues, or it could be potential damage to your tissues, or damage to your nervous system that is sending incorrect messages to your brain. So the damage can happen in different ways depending on where in the brain the stroke has happened. The damage to the nervous system, sometimes it can repair itself, or it can repair itself to a point, the neuropathic pain, that can actually get better. The nociceptive pain, which is the actual physical damage to the tissues, it really depends how much the tissues heal. Restricted ability to perform physical activities or exercise, that's often a common change after stroke. People's movement might not be as good or as quick or as strong as it was before, so they can't get about in the same way, really. Swallowing issues, Depending on, again, which part of the brain, it could be your sort of speech area and your swallowing area, and that can be quite difficult. So that needs to be tested out very carefully. And if someone is having swallowing issues, they need to be managed by a speech and language therapist, and you need to be guided by them in telling you what to do with someone's swallowing. They'll do quite a lot of tests to find out the extent of their swallowing. Visual problems, as we know that left or right, one part of the vision can be affected, and that might be something that's new to someone, or they might just have, needed glasses for reading, but now there's sort of limited vision. And if that happens, then that can actually be quite frightening to people. So you need to be fairly empathetic as a carer. You need to be thinking about what you can do to support them. Weaknesses or paralysis on limbs, one side of the body, we know that is one of the sort of classic possible physical changes. Not only are there physical changes, but there are also emotional changes. And also we do know that with our signs and symptoms, there can be some personality changes as well, depending on what type of stroke it is. So if people have suffered a stroke, it's not uncommon to have changes in their mood. Some of them are sort of obvious, really. People can get depressed, they can get frustrated, they can get angry because their body suddenly doesn't work the way it did a couple of weeks ago. But they can also, and this is logical. It's not always part of the stroke. This is logical, somebody having depression because their whole life has changed and maybe they can't go to work anymore. So you need to be, considerate and aware and be able to be available to talk these things through with people, because you might find you might be able to find things that they can do in time. Now, it's not something that they can always do early on, but maybe later on they can go back to work. But at the time, somebody might feel, it might feel very, very hopeless for somebody. So just be aware of that. Depression is really common in that first year after stroke, but it's particularly common for people who have speech problems as well. So if the aphasia stays with them for a while, they become even more frustrated, and they can get very, very depressed, not surprisingly, because they can't communicate with people anymore, or they can't make themselves understood. And that has a very profound effect on people. So what are the symptoms of depression? This is just a general thought. This is not just about depression with stroke. Have a think about what symptoms you know. Maybe like jot some ideas down before you sort of move on. Feeling sad most of the time, feeling tired, feeling worthless, finding it difficult to concentrate, finding it difficult to manage everyday life, having difficulty sleeping, or sometimes sleeping much too much, not having difficulty getting up, really, going to bed and staying there and, pulling the duvet over your head and not really wanting to think about it. Losing a sense of enjoyment, really, in the things that you like to do, or particularly if you can't do those activities that you used to do. That can cause a great deal of depression as well. People can lose interest in food, they go off their food. On the other hand, they can eat too much because, maybe eating's the only thing you can do. If you can't do some of your activities anymore, eating for some people is a comfort. So they may well turn to food as well. So it can be losing weight through not eating because you've lost interest in, that level of enjoyment, or gaining weight because that's all you're doing is eating because there's not much else that you want to do. After stroke, people can suffer from anxiety. The anxiety can come attached to depression, or it could be on its own. And anxiety is a bit more than just feeling stressed. We all have a level of anxiety at some times. If we're going for a job interview or if we're about to take an exam, there's a natural level of anxiety there. But this is a little bit more than that sort of feeling, because that's a feeling that happens and then eases off afterwards. So people who are anxious can find it really difficult to calm down. You may have to sit with them. You may have to get them to do a bit of deep breathing to calm down, or you might have to use a calming tone of voice to be with them. They can often feel worried, which is, very stressful and very tiring if people are constantly worrying about something. They can feel terribly frightened by an intense panic, but it might not be focused. It might be just a sort of free-flowing anxiety, which can be really difficult because they can often not explain to you exactly what they're anxious about. They can have some thoughts that just increase their anxiety, like I'm never going to walk again, I'm never going to speak again, and that that could just increase and cause them, cause their anxiety to really spike. So the important thing is to try and help them avoid situations that can add to their anxiety. As I said, you know, calming, quiet spaces, really. But if you know there's something that they're getting anxious about, then, try to find a way of either avoiding it or, doing it in a way that it reduces the anxiety. And again, it's all about the relationship you develop with the person that you're caring for. So you get to know what situations make them anxious or not. Now we know there can be some personality and behavioural changes. We discussed that in our previous sessions. The sort of things that can happen: irritability, things that maybe wouldn't normally annoy somebody but does now. They can even become aggressive physically or verbally, and this can be very painful for family and carers, children, spouses, husbands, wives. They can find this very, very difficult to deal with, really. Apathy or lack of motivation is a lot more common, because if you feel that you physically can't do something, it's quite hard to motivate yourself to keep doing the rehab exercises. Sometimes it's easy to say, oh, well, my life's over, you know, and that becomes quite difficult. You need a huge amount of patience to work with people when they're feeling like that. And it is a feeling, and you do need to be empathetic to it. And most important thing is not to disregard it, to acknowledge it, but maybe sort of tie it into a bit of reality, saying, well, yes, I understand you do feel like that because, this has been a terrible event for you, but there are things you can do to be better. They can get stuck in a bit of repetitive behaviour. That often depends what part of the brain's being affected, particularly where their speech is involved. Unfortunately, they get stuck repeating words, and they want to try and say one word, and they just keep saying this other word. It's the only word that comes to mind. They're usually quite short words like cat or cup or something, and they'll end up saying it about everything, and they don't mean to. It's just that's the only words that they can come to. So they can also develop some repetitive behaviours like picking things up, moving things around as well. But it does actually release some tension for them when they do it. Disinhibition, tendency to say things and do things that are socially inappropriate. You might have someone who's always been quite prim and proper, quite serious, and then all of a sudden they can become, as part of the effect of the stroke. Whether it's a right-sided or a left-sided stroke. If it's a right-sided stroke, they can become disinhibited or they can become impulsive. Tendency to say things and do things that are socially inappropriate. So they might embarrass themselves, or they could be embarrassing for you. They could be loud when they should be quiet. They should be sort of happy when in a situation where you need to be serious. And again, that's the stroke is affecting that part of the lobe, which is usually in the cerebrum, the part that actually deals with sort of mood, behavior, and personality, and it can change it. Changes to thinking, memory, and perception. It can change how you remember things, and if you remember things, and it can change your thinking processes sometimes. Sometimes they may work in a different way, or sometimes they might not work at all. It can change how you hear things and how you see things in a way, not in the physical, but in your understanding of things. So it can affect your feelings really about yourself, your family, and people who are important to you, which again can be quite painful to the family. Cognitive skills can be affected. It can change the cognitive skills. It can make it difficult to learn new skills. It can affect your planning ability and your problem solving ability. One of the things it has a real effect on often is people's concentration, where they used to maybe concentrate on small detail work. They find that quite difficult, or they sort of drift away to do other things, so they lose their focus as well. Orientation can can be affected, not really knowing what day it is or not being able to hold that information. Like, so if I tell you it's a Tuesday, I come back to you in half an hour's time, you might not remember it's Tuesday, so you might ask me again. Um, and this also becomes an issue if you can't remember your family and your offspring. So when your grandchildren come to visit you and you say, "Who are you?" it can be very, very distressing, especially if the children are quite young. So as carers, we need to make sure that people are aware of these problems before maybe they meet up with their loved ones, so that they don't get too upset. You can say, look, part of his stroke means that he can't always remember people's names. He doesn't always recognize faces now, so try not to get upset. Also, short-term memory. If I ask you what you did an hour ago, you may not be able to remember. You may be able to tell me what you did 20 years ago, though. Strangely, that gets less affected. Perception. What do we mean by perception? Have a think about it. What does it mean to you? What does that word mean to you? Take a moment to think about it. Okay, let's see what I mean by perception. So it's a term that describes how you see and hear the world. And after a stroke, perceptions can change. Um, Things like judging distances. Now, some people are always better at that than others anyway, but that can really affect. So what you think is a meter maybe is like much, much bigger or much, much less, and you can't really work out the differences. When you contact pain, heat, or cold, you might not feel it enough. So that could actually cause bodily damage if you're not careful, because you could hurt yourselves by putting your hand on something that's very hot, and you might not be sensitive enough to feel it, or not feel it for quite a long time. Performing certain movements, that's usually related to balance, so being able to hold yourself up. Recognizing shapes and objects. Sometimes people look in the mirror and they don't actually recognize themselves, which is, you can imagine that's quite terrifying for them. Seeing or feeling things only on one side. If you think that if someone's got very severe weakness on either the right or the left side, they can sometimes lose nearly all of their feeling on one side. Unfortunately, when people are moving around, it can cause them to bump into things and do damage and not know they've done it. They can actually hurt themselves, but because they don't really have much pain receptors going on, say, on their right side or their left side, they bump into things, or they bump their feet or bump their knees or their elbows, and they don't really know. So they could actually injure themselves quite severely. Watching TV or reading can become difficult, but with a bit of work, for some people that can improve. And vision, some people can lose, as we know, vision in each eye. And depending on whether it's a right-sided or a left-sided, you'll lose vision in the opposite side of the eye. So right-sided, you'll lose the vision in both eyes on the left side. Left-sided, you lose the vision in both eyes on the right side. Remember, so it's always opposite. So that means you've got an eye that has vision here, but not here. And that's a very different and strange type of vision. And that'll take a bit of get used to. Okay, communication. For a lot of people, stroke affects the part of their brain that really affects speaking, reading, and communication. And some of the difficulties here, if you have a look at the symptoms of what is known as aphasia, and that's when people can't find the right words or don't understand. So there's a variety of symptoms. Do have a look on the screen there, and it's either aphasia or dysphasia. Aphasia means that they have no understanding or it's not working at all, and dysphasia means it's not, it's reduced. What we tend to find nowadays is healthcare documents tend to use aphasia for everybody, even though they may not have lost all of their speech, it may be just reduced. They tend to use the word aphasia to cover everything. So don't be surprised if you see aphasia, dysphasia a bit interchanged, really. Weakness in muscles that help speech, so the actual weakness in the muscles around your mouth that help you shape the words, that's dysarthria, okay? And dysfunction of the nerve connections between your brain and the mouth, making speaking difficult. So this is the nerve that sends the command to your mouth to actually say cat, dog, whatever. And if there's a dysfunction there, that's known as dyspraxia. So that's a word you'll probably hear quite a bit. And also there are reading and writing problems caused by, you know, the fact that people may have a weakness. They may be a right-handed writer and they may have a weakness on their right-hand side, so their writing will be affected. Either they may not be able to write at all, or they may, you know, write quite badly. Some people might start trying to use their left hand, so that will probably never be quite as good as their right hand, so their writing will be affected one way or another. So finally, let's think about everyday life after a stroke. It does mean changes. It could mean changes in your living arrangements. You may need to move to a residential care, or if you could, you know, if you want to try and stay at home, you may need to modify the house to make it work. You may need ramps, you may need wheelchair space, or you may need extra width, or you may need a walk-in shower when you had a climbing bath because you physically can't move that side of your body that well. It will affect people's sexual function and that will affect their relationships. So that's an issue to think about as well. If you're a home carer coming in, you know, you may, they're sensitive areas, but they may want to talk to you about things like that. It may well affect someone's ability to handle very complex skills such as driving. They may be told they are not allowed to drive. They may regain that skill later on, or they may never be allowed to drive again. It really depends on the severity of the stroke. Or they may be able to drive an adapted car. There's lots of people who've had a stroke but have regained a certain amount of movement, actually use an adapted car. Level of independence, that will be affected. Even the people who live at home may need some care support coming in to help them. Could be family, or it could be paid carers from a nursing agency. But that can certainly affect people's independence, and they can find that really, really difficult. They may not be able to go back to their job, depending on what their job is. If you had a stroke and you're a firefighter, the chances of going back to work are sort of pretty limited, really, because the level of physicality that you need. If you're an office worker, you might be able to go back. It really depends what you do and how much support you can get. So for some people they do, or they may not go back to the job they had before, but they may be able, with specialist rehabilitation support, they may be able to work in another field. So it's quite possible. But it is a change, and it is some sort of change. Even if it means they can't work for a period of time when they're having their rehab, you know, for most people it could be 6 months to a year at least if they don't get to work. So bear in mind as a carer, these are all the things to think about for your service user. Okay, And that's the end of this part of the unit. Have a look at that, read it over, think about it, and then we'll look at part 4 for the second half of this week. Okay, thank you very much, and I'll see you again.